Good morning. Our topic for today's final presentation is work physiology in aviation, and this is presented by the group members of Group 7. So, work physiology is an extremely important part of the aviation, of human factors in aviation, and this is because even though our bodies are generally well equipped to handle any ground activities, this does not generally extend to air travel. And so, throughout this presentation, we will further explore different aspects of how work physiology is integrated into aviation and cover topics such as jet lag, spatial disorientation, respiratory system, and pressurization. So, starting with jet lag, one of the most common challenges on work physiology. So, what really is jet lag? So, long haul flights, as we all know, are a very common experience and, in fact, very imperative to multidimensional growth. And even though long haul flights are becoming increasingly common, it doesn't mean that the body is used to the changing time zones and long hours of travel. And the body often announces this kind of disruption in the form of something called jet lag. So, jet lag is a temporary circadian rhythm disorder that is a side effect of long haul flights and is characterized by daytime fatigue, sleep wake disturbances, decreased appetite, constipation, and reduced cognitive skills. So, what is circadian rhythm? Circadian rhythm is the body's 24-hour internal clock that controls the sleep wake cycle, and jet lag is often due to a misalignment between the body's internal clock and the external cycle of light and dark. So, the physiological impacts of jet lag are dependent on flight direction and length. This means that westward travel causes a phase delay in circadian rhythm, while an eastward travel causes a phase advance. And travelers often find it harder to sleep in eastward travel due to the internal clock being forced out of its 24-hour cycle. Some of these physiological impacts include decreased alertness, weariness, irritability, impaired performance, sleep-wake cycle disturbances, decreased appetite, reduced cognitive skills, and gastrointestinal distress. There are also some long term effects of jet lag caused by a longer period of air travel, and that causes a cumulative sort of perilous effect. These might include disruptions in menstrual cycle and severe cognitive defects. Jet lag also often causes disruption in food intake and causes us to take food at inappropriate times, which can lead to cardiovascular diseases. The immense power of circadian clock is such that it controls cell proliferation and repair, and often due to increased air travel, this disruption in cycle causes a less efficient repair and might lead to tumor development. So, this diagram represents time givers or activities that we give our time of day to in order to enforce routine as part of the circadian rhythm and keep maintaining the body's internal clock. One of the most important time givers is the light dark cycle, but some of the other non photic time givers are sleep wake cycle, physical activity, social time, and meals. So, some of the effective measures that we could take to control jet lag and its physiological impacts includes food and supplements, deliberate light exposure during phase shift, which is a part of something called phototherapy, pre-flight sleep hygiene, and melatonin. So, pre-flight sleep hygiene is a regimen that is basically practiced to ease the segue into changing time zones. And it is recommended that we sleep 1 hour later during westward travel and an hour earlier during eastward travel. Melatonin is a supplement that can ease the effects of jet lag on a physiological level, but is not really recommended for flight crew as it might interfere with their onboard duties. So, as we can see, there is no one formula to cure jet lag, but people do benefit from personal strategies that they adapt by traveling frequently. Even being aware of one's changing circadian rhythm and the impact that it can have on a physiological level might help us to take measures that are somewhat effective, if not completely remedial.
So the next aspect of work physiology that we will discuss is spatial disorientation. Spatial disorientation, as the name suggests, is a term used to describe the discrepancy between the actual attitude of the aircraft versus the attitude that the pilot thinks that the aircraft is in. For example, if a pilot happens to fly into cloud, they may not realize that they are in a slightly banked attitude or are in a slight nose down attitude, which could result in catastrophic consequences if not corrected for. So spatial disorientation is caused by a discrepancy in our perception of the environment by our sensory systems. Humans have two main sources of sensory information, the visual system and the vestibular systems. The visual system is quite easy to understand, but the vestibular system is slightly more complex. It consists of two main components in our semicircular canals, which detect changes in gravitational and angular forces. Now, there's an unconscious expectation that gravity is steady across all points of the Earth's surface, and that the Earth will be stable. But this assumption can no longer be made when we are in flight. Our plane is not moving on a stable ground base, and thus we cannot operate as if we are still on the ground. So here are just a few common illusions that pilots can experience when they are spatially disoriented. First is a somatographic effect, which is one of the many examples of our bodies thinking that we are still on the ground when in fact we are in the air. This illusion creates a feeling of a pitch up attitude when we are accelerating and a feeling of pitch down attitude when we decelerate. The next illusion is the Coriolis illusion, which occurs when one leans their head or tilts their head during a turn, which results in an almost unbearable sensation that the aircraft is rolling, yawing, and pitching at the same time. Lastly is the false horizon, which is caused by clouds or foggy or misty conditions which obscure visual conditions outside and give the pilot a fake sense of the ground below. The best ways to prevent and solve problems associated with spatial disorientation are to recognize when it is happening and to know how to get out of it. The easiest way to do this is to demonstrate to student pilots just how dangerous spatial disorientation can be and to teach them to use and trust their instruments if and when external visual cues deteriorate. Some other possible solutions that may already be in use today are user-worn or heads-up displays that give pilots the most important information, such as artificial horizons, airspeed, and altitude indications. Lastly, many military pilots use tactile torso displays that pilots wear as a vest that could alert pilots of deviations from the intended attitude of the aircraft. In short, spatial disorientation is dangerous and can be solved using proper training.
A pilot's workspace is very different and unique compared to the average person's work area. This is because pilots face other factors that normal people will not have to face in a day-to-day life. One of these factors affecting them is the respiratory system. This is because the respiratory system can be gravely affected at higher altitudes due to the high pressure levels and the low amounts of oxygen. In this section, we'll talk more about how we can prevent these occurrences from happening and what are the effects of them. Hypoxia and hypoxemia are two very common disorders that can occur at high altitudes. It can have severe effects on the human body and, if not caught, can eventually lead to an accident. Oftentimes, hypoxemia and hypoxia are confused between the two. Hypoxemia is when there is a lack of oxygen in the blood system, while hypoxia is the lack of oxygen being brought to the muscles and the tissues of the body. Hypoxia and hypoxemia have both minor side effects while also having very severe side effects. Some of the minor side effects are coughing, wheezing, and headaches, while the more severe side effects are difficulty speaking, fainting, temporary memory loss, difficulty moving, shortness of breath, feeling confused or disoriented, and a rapid heartbeat. The more severe side effects can eventually lead to an accident if not caught in time. But there are symptoms displayed before any of these take place. If you notice bluish coloring in your fingernails or fingertips, you may be experiencing hypoxia or hypoxemia. Smoking also makes pilots more susceptible to these disorders. That's because their blood systems consist of less oxygen and more CO2 levels than a non-smoker. This means that a smoker will experience the symptoms of hypoxia and hypoxemia earlier on compared to a non-smoker. Thankfully, due to modern technology, neither hypoxia or hypoxemia are likely to occur. This is because we now have pressurized cabins and supplemental oxygen. Also, if one is experiencing any of these symptoms, the pilot can simply lower the nose of the aircraft to descend in altitude. This will help them recover. It has also been proven that companies that implement programs for smoking or incentives to encourage smokers to quit notice a big drop in smoking.
The last topic we will explore is the pressurization of a cabin. Airline crew and passengers are at risk of various physical and mental impacts when flying at these high altitudes, where they may be vulnerable to experiencing decompression within the cabin. Individuals face many human limitations when flying in a high altitude climate. Pressurization systems are a need and a must to ultimately avoid the serious effects of decompression and other health-related dangers. A pressurized cabin is crucial when maintaining a high-pressure environment that allows the flight crew and passengers to fly at these high altitudes comfortably and safely. The risk of experiencing loss of pressure can be quite harmful and possibly lead to health risks, injuries, and even fatality. As previously explained, hypoxia symptoms can occur when there is not supplemental oxygen available that may be caused by the decompression of a cabin. The next danger is altitude decompression sickness, which is essentially when an individual is exposed to reduced barometric pressure, which can cause the nitrogen to be released from our bodies and form tiny bubbles in different spots of the body and in the tissues. A common side effect of altitude decompression sickness is joint pain. In severe cases, it can produce neurological symptoms that are extremely serious to flight crew members. Another danger includes an increase in blood viscosity, as studies have found that a limited air pressure environment allowed for greater blood fluid loss and an increase in blood viscosity in the sample patients of the study. All these hazards can jeopardize a pilot's judgment, decision-making skills, cognitive thought process, interactions between systems, and can influence many other factors that are important to maintaining the safety of the flight. 40 to 50 events related to the decompression of an aircraft's cabin are reported annually across the globe. A case where an aircraft experienced complications associated to the loss of cabin's pressurization system is Flight 522 of Helios Airways, otherwise known as the Ghost Flight. This flight tragically crashed in 2005, where 6 crew members and 115 passengers on board died. There were several issues that were reported in the investigation that were known to follow the notorious crash that ended the lives of many. These complications that arose included how the pilots were unaware that the cabin pressurization selector was in manual position, as well they did not acknowledge the warnings that were activated. These signals included the cabin altitude warning horn, passenger oxygen mask deployment indication, and master caution. The flight crew became susceptible to serious symptoms of hypoxia that left them unconscious and unable to fly the aircraft as it went on autopilot, until the aircraft eventually used up all the fuel and tragically crashed somewhere in Greece. This is one of the serious cases where the extreme symptoms of hypoxia from the decompression of the cabin can infiltrate an entire aircraft and leave passengers and crew in a state of hypoxia where they can develop ineffective judgment, sickness, and soon unconsciousness. As we discuss the theme of work physiology throughout the aviation sector, we provided a further understanding of how human factors interplay within the disciplines of aviation physiology. It is important to consider how jet lag, spatial disorientation, the respiratory system, and pressurization may affect an aviation professional's ability to safely perform tasks to ultimately avoid unfortunate outcomes. As presented above, there is an old Western quote, "There's never been a horse that can't be rode, and there's never been a rider that can't be throwed." This quote exemplifies how human limitations are inevitable, and how this applies to how aviation professionals, no matter how skilled or trained a pilot may be, they are not incapable of having an accident due to a variety of circumstances and the presence of human factors. Thank you for watching our presentation on how the challenges of human factors occur within the theme of work physiology.